Bismillahirrahmanirrahim. GIT problem in the pregnancy. One of most common presentation is vomiting. So vomiting is normal if it's in between the 6 to 14 weeks, which is in early morning vomiting, but it's not affecting the general condition of woman. So, but if it's a severe vomiting, which is affecting the woman condition, this is considered as hyperemesis gravidarum. So, this is emesis gravidarum, and this is hyperemesis. Okay, if it's before 14 week and it's a severe vomiting, so this is considered a hyperemesis. So, or if it's persist after the 14 weeks, mean it's up to the 20 weeks, so then it's considered the hyperemesis gravidarum. Okay, so this is also known as morning sickness, the emesis gravidarum, while this is hyperemesis. Okay, so this is nausea sometimes accompanied by vomiting. It's up to the 12 or 14 weeks, and it's not affecting the general condition. Means it's not causing the severe dehydration. So vomiting that allows you to keep some food down. Okay, but this is nausea that does not subside, and vomiting cause severe dehydration, decrease in the urine output. So, and the patient is unable to take some things. So then there is a big problem which causes weight loss, or more of the pre-pregnancy weight, headache, confusion, jaundice. So it's it's disturbing the normal condition of woman. So for this condition, which is MS gravidarum, so simply you reassure the patient. She had to take small frequent meal. She take meal, but in the small dose, and it's a frequent meal and intake as per rate, and high protein snacks, and avoid the spicy or fatty food. She should increase the carbohydrates and protein and decrease the fatty thing. Okay, anything avoid the anything. So because it's not disturbing, it's a normal condition. So just to reassure the patient. Okay, for this condition, hyperemesis gravidarum, so there are different theories regarding this condition, like the psychological, and because it's in the pregnancy, uh, disturbing the psychology of some women. So this is due to this, and due to the ovarian hormone estrogen progesterone, which can stimulate the stomach, which causes the vomiting. The chorionic hormone, which is stimulating the stomach, reduce the motility or secretion. They are affected in a different way. Okay, so these are different theory regarding the hyperemesis condition. Okay, so in the morning sickness, it's normal. If it's excessive vomiting, it causes the dehydration, which can cause the hemoconcentration, raise the blood urea, and cause the affecting the urine. They cause the oliguria, concentrated urine, low urine chloride, ketone urea, protein urea, bile salt. So these conditions are due to starvation, which can cause better when there is low glucose, which go to the ketone side, which causes the ketosis. And okay, it's the starvation affecting the liver, which causes the hepatitis, polyneuritis, emaciation, and Wernicke encephalopathy. Wernicke is actually thiamine deficiency. Okay, Wernicke's problem, which causes confusion, ataxia, or ophthalmoplegia. So this is the code. Mnemonic is code. C, confusion, O, ophthalmoplegia, and A is ataxia, and T is the thiamine deficiency. Okay. So, so etiology, as I mentioned, high level of HCG, which causes allergy to some women, or low level of thiamine, vitamin B1 and B6, or psychogenic. Okay, so there are other, and this is not limited to hyperemesis. There are other causes of the vomiting in the pregnancy. These are either OBS or non-obstetric condition. For example, gynecological or gastrointestinal, hepatic, renal. Okay, so in the early pregnancy, there is a hyperemesis gravidarum, vesicular mole, or the multifetal acute polyhydramnion, or we have gravid uterus. Okay, in the late pregnancy, placental abruption. So there are so many causes of the vomiting. So how you can rule out? Simply go for the investigation: CBC, electrolytes, BUN, and the LFT, urine lysis, and creatinine. So if you look at this picture of the investigation, then you can clarify your the diagnosis. Okay, and for the complication side in pathogenesis, due to dehydration, there is a hemoconcentration and there is electrolyte disturbance cause starvation, ketosis, as I mentioned. There is a decrease liver glycogen and increase the liver enzyme AST and ALT due to hepatitis. Okay, and Murray-Waite syndrome. This is actually the what is the Murray-Waite syndrome? This is actually tear in the gastric tract. This is due to the hyperemesis, mean more and more vomiting, which is damaging the mucosa of the gastric tract. Okay, so these are actually tear in the GIT tract, and the vernix, as I mentioned, this is thiamine deficiency, which causes confusion, the ophthalmoplegia and ataxia. Okay, due to thiamine deficiency. Okay, if you do not treat it, it cause a poor outcome. For example, intrauterine growth retardation, preterm low birth weight. Okay, so low birth weight is a big problem. Okay, investigation, same the sodium electrolyte LFT, hematochloride in the urine. How you treat it? Simply hospitalize the patient, stop their oral intake NPO, okay, and the IV fluid, and correct the electrolytes. You can give the thiamine supplements, okay, and give the, if it's needed, give the antiemetics, especially the phenothiazine, which is safer and commonly used. You can use the other antiemetics also. Okay, so but phenothiazine is commonly used, and rarely terminate if it's a severe condition of encephalopathy. Then you can terminate the pregnancy. Okay, so this is the Murray-Waite syndrome, where you can see the tear in the gastric mucosa, and here is a Wernicke encephalopathy, mnemonic code, confusion, ophthalmoplegia, ataxia, thiamine deficiency. Thank you very much. Allah Hafiz.